old fashioned red. It's a Maker's 46 old fashioned. Good morning. How are you today? Yes, again.
I saw you a few weeks ago.
Yes.
At the radio station.
You got it. Absolutely.
Worked in healthcare here for the last 15 years, and happy to be part of Healthcare Day. Welcome, enjoy your day. Any questions, anything you need, come to me before, after, during, and look forward to getting to know some of you, some of your faces I don't know yet. So enjoy your day, and I'll see you guys over at ShorePoint.
What's that? I know. Yeah, absolutely.
That's one of the best parts of watching videos, watching everybody get up.
Yeah, right. Hey, hey, hey.
Gets better.
I'm the designated patient. You're the designated patient for today.
Some great leaders here that I'd like to introduce you to. Russ, our Chief Nursing Officer, he's going to say a few words, and then Lisa, Assistant Chief Nursing Officer. And we have Devin, who just joined the ShorePoint team, marketing coordinator, and Amy, longtime friend and coworker of mine, Director of Women's Services. Take it away.
All right, good morning. I found I was going to do this about 15 minutes ago.
You got voluntold.
Other duties as assigned, right? So I pulled a couple quick numbers to start out, just to share a couple things, because we shared this with our board a couple weeks ago, and I thought it was pretty impressive. We provided 75.4 million in charity care in the year 2021. And this is just at this facility. So $74 million in charity care. We saw over 141,000 patient encounters through Port Charlotte, either through our emergency department, the surgery, outpatient labs, or the physicians that are employed through Port Charlotte. We are licensed for just over 200 beds. I think it's 206.
254.
254. Punta Gorda's 206. 254 licensed beds here. Our average daily census hovers around 140 patients. So our service lines here are general med surge, cardiac, women's health. We do have some pretty advanced cardiac, so we do open heart surgery. We also have a hybrid OR where we do some pretty complicated, what's called TAVRs, and structural heart program. So we do surgeries that used to require the chest to be open. We replace heart valves through the groin. If you have questions, let us know. We're here to help answer those and let you know. Yeah.
I've heard a lot about nursing shortages. How's that affected you, and how do you handle it?
Well, before COVID, I had a full thick head of hair. And it was all dark black. It was just incredible, wavy. Now, it has been a challenge. Huge amounts of nurses have left nursing altogether. And we have, in the past, we saw roughly an 18% nurse turnover rate. We have seen, annualized year to date, we've seen a 37%.
Like Ross, I'm incredibly proud of this hospital. I've been here for 6 years, started out at the bedside in the open heart unit, which we will be touring this morning, and then moved up as I continued on in my education. We take really good care of the patients that come to see us, but in addition to that, we reach out into the community that we are a part of. We partner with Virginia v. Andes, and we do free phlebotomy work, free surgeries, free CAT scans, and other radiology tests for patients in the community that don't have resources. But during COVID, one of the other things that we did was we went out. I know I went out multiple times into the community with Jen McManus, and we talked about COVID, we talked about the virus, we talked about the vaccine, the myths and the truths about it, and just educating the community about what was going on. So I think the hospital is very committed to the community that we are a part of.
We're going to drop patient Omar off in L&D. NICU.
And we can say that during one of our hurricanes, where we had to evacuate the first floor, we did have men come on this floor. And so we did have a joke with him. He was like, I'm not here to have a baby. So this is our waiting area for the whole women and newborns unit. So we are going to deliver and go down to postpartum where they are. And then this part starts our labor. You can see we've got everything here. Our labor and delivery beds actually break down in half for delivery for those of you who may not have either been present when your child was born or just haven't had any children. This half of the bed comes off and the physician is here and we have our whole setup. Our babies go right, do skin to skin. So we participate in something called the Paired Initiative through Florida Perinatal Quality Collaborative. So baby's born, right to mom's chest, and baby hangs there till whenever mom wants to have a wait or have anything done. Baby can be nursing while we do the medications, and they usually tolerate that very well. So,
Do the babies ever go to like a separate room, or are they always with mom?
they're always with mom as long as they're healthy. If for any reason baby is sick, requires oxygen, anything else, IVs, then they are separated from mom where they go to the NICU, which is where we'll be going next. This is our NICU. We are a level 2 NICU, which means, used to mean 32 weeks, 1,500 grams. ACA just changed the guidelines that took effect this week. We can do 30 weeks and 1,200 grams now. If they're not positioned correctly, like she's trying to burp a baby, sometimes their oxygen saturation will drop a little bit. Had an infection during her pregnancy and the baby needs to be treated with antibiotics and have an IV. So those babies will be in here and will be monitored closely, depending on the infection, and then antibiotics that they need to be treated. If mom had a temperature in labor, and we suspect that she got an infection during pregnancy or labor, baby will have blood work drawn and may or may not be treated with antibiotics.
Drawn and newborn.
So a lot of different things. So they're usually very agitated. They don't sleep well. They're constantly awake. They just cry, 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 cry. It's a high-pitched cry. It's not a normal newborn cry. They can have sweating, sneezing, and it's not just a sneeze. It's like repetitive sneezing that they're doing. They can run temperatures. They will have very liquid diarrhea stools.
So I'm assuming you take care of preemies here, correct?
We do.
Okay, so do you have preemies medevac or ambulanced here from surrounding areas
They
that don't have the
usually
facility?
come here to us, depending on what age they are. So, for example, DeSoto Memorial several years ago closed their women and newborns unit. So we do get a lot of their patients here. So if they happen to deliver a baby and it meets the guidelines to come here, that baby can come here with mom.
Where's
Gotcha.
the majority of your patients that need to go to a high level of care? Where are they going?
So our physicians, our neonatologists, they come out of Johns Hopkins All Children's. So typically they will go to Johns Hopkins All Children's.
CPR for infants, the compressions, and ambu bag. I used to fly medevac
Yeah.
worldwide, and we'd deliver babies between Hawaii and Korea all the time, transporting preemies to Tripler, and they would not make it there, and we were doing this the whole way down.
Oh, well, now we don't have that here, but I don't know. We are not the transport team. The transport team comes to us.
Yeah.
So I don't know if they
Got it.
have that capability. Is the 2 beds. Mom, we keep closest to the bathroom so that she doesn't have as far to walk. And then Dad does that second. Yep. Okay.
We're here on the 3rd floor of the Heart Tower. So this building on the 1st floor is the ER, Second floor is, the footprint looks the same, so the rooms are the same size. The difference is on this floor, we call it a step-down unit. So nurses are normally 4-to-1 or 5-to-1 patient ratios. On the second floor, it's an ICU. Executive Director over the cardiac service line.
How are you guys doing today?
Doing all right.
Step right this way. This is one of the cath lab rooms where we operate. This is kind of like a color of workforce room. This is where we bring like our emergent, like STEMI patients having a heart attack. This is where we would go to bring these patients to do any kind of heart stents and that kind of thing. We also do procedures in here such as pacemakers, defibrillator implants, and those type of procedures as well in these rooms. Everything that you see here, this is where we do the fluoroscopy, all of our procedures. We do use x-ray to be able to illuminate the vessels in there, so the actual procedure for when somebody comes in here for a heart catheterization is in relation to checking to make sure if there's a blockage in the heart.
So my name's Jonathan, like you said. I work for Biosense Webster, and we run a mapping system called Cardo.
Do you guys know what AFib is?
Atrial fibrillation.
All right. Do you know what it is, though?
Yep.
Okay. All right.
So
Maybe not all of us.
Okay, good, good.
Your heartbeat isn't right.
Right.
Atrial.
So there's 4 chambers of the heart. The top 2 are called what?
Atrium.
Right, there we go. And there's an area called the sinus node. For your body, that one area is normally what sets your heart rate. And so that sinus node, every cell in the heart can be a pacemaker. It has that ability electrically. But for some reason, it's not working as well, and the top 2 chambers are shaking, and the bottoms are squeezing. And so they're fibrillating, they're just shaking. And what can happen is you can form a blood clot in that because the blood's not moving efficiently. And then when they do squeeze occasionally, that can shoot out and cause a stroke. So what these guys are able to do is mapping. They do this 3D mapping so they can spin the heart around and they can look at it and see where the electrical impulse is starting. And if it's starting in the wrong area, then our doctors have the ability to go in and do what's called an ablation, where they
our, what I would call our overnight coronary stay unit. We call it ICCs, an interventional cardiac care. So we have 16 private rooms that swing like in an L shape from this direction to the other direction on this unit. And so this unit, these rooms are all private rooms for the patients. Typically, a lot of our procedures these days are actually being done in the same day.
And now we're doing more where?
Radial.
Radial.
And actually we have a physician that's doing distal radial. He's even going through here to do a heart catheterization for,
So from your wrist
procedure.
all the way fed up through your shoulder and into
Yes,
your heart.
all the way through there to fix any kind of blockages that are in your heart. It's very, very rare to see a complication post-radial procedure. And like I said, we've got one doctor doing distally, and it kind of goes down almost into the thumb region here and goes from that direction.
Wow. So what advancements in technology are allowing you to, for expediency purposes, get that done within, a short period of time? Is it better optics at the end of the instrument? Is it X-ray? What is it?
It's honestly, it's identifying it from the get-go, I think, in my opinion. It's like that identification piece of saying, so really technology-wise, from the heart catheterization standpoint, I don't know if actually the diagnostic part of that has changed a whole lot, because it kind of is the same situation. You want to get, so really the thing with this is, I think, the identification of the patient to know what you're looking for from the very beginning.
So we didn't stand in the hallway coming in because it is a small area. But when you come in, our founders are on that wall. Dr. David Klein, almost everybody knows him, and Dr. Mark Esperilla, and here comes Suzanne, our CEO. I said, we got a full house here.
Welcome. Ouch. Welcome, welcome, welcome. Welcome.
And Tom Farrar. And a lot of people don't know that it did start as a pharmacy in 2000 and then expanded into the clinic and what you're going to see today, which is amazing. People who have not been here are truly amazed because there's 30,000 people in Charlotte County without insurance. So imagine an organization that can service that many people. We don't have 30,000 patients, but we will someday. We're a full dispensary. We do not do narcotics, but anything anybody else needs. So they have diabetes medications, cholesterol medications.
Patients here, is it just a matter of not having health insurance, or do they have to qualify financially as well?
They have to qualify financially. It's 200% below poverty level. We follow
200% below poverty level?
We follow
On or below?
On or
Right.
below. We follow the same guidelines as the health department and, for Medicaid. If we can get somebody qualified for Medicaid and or Medicare as people age, we're going to do that. We also have a PAP program, which is beneficial to people who have certain medications that are so expensive that we can't carry them.
So I just want to say thank you all for coming. Leadership Charlotte is very dear to my heart. Class of 2014, yay. Go green.
Go red.
Go green. I see a lot of familiar faces, but I see a lot of new faces too. So Karen is going to, she's our Director of Ground Development. She's going to take you on the tour today. On that tour, you'll be able to meet our Clinic Services Director, Janice Chickas.
Celeste is not here yet, but she's our representative on the collaborative because when somebody is in that kind of financial need, it is not just medications, it's housing, it's all the other things they have to deal with in their lives. So we're part of that within the county so that we can meet all those needs. And it's not something we do, we have connections with the other. There's nothing wrong with being uninsured. And during COVID, we got a lot more patients because a lot of people lost their jobs. So sometimes it's a temporary fix. Sometimes it's just to get them over that hurdle. We had a lady that came in yesterday. It was really sad for me. Her husband put her out. But it is a full dispensary pharmacy, just like Walgreens, just like any other retail, just a little bit smaller. But we do just as much volume. But the difference is we don't have to pay the price that they pay. So our pharmacist is amazing because they work with all the big pharma in order to pay a small amount and get a large percentage back.
I'm Janice Chupka. I'm a physician assistant. I have been one for over 25 years. And I started out as a volunteer over at Inglewood Community Hospital. Well, not Community Hospital, but Inglewood's their volunteer little place over there. And somebody said, I live in Punta Gorda and I worked at Fawcett. Why do you go all the way over there? And so I came here. And when I did, they said, well, we're looking for somebody to run the place. And since I've done that in my lifetime, ran a few clinics, I said, okay. And so here I am. And I have been here 5 years and I absolutely love it. I love to give back. My whole family gives back to Charlotte County. We moved here about 6 years and we think it's a pretty cool place to give state-of-the-art care as best as we can. But we couldn't do it without our volunteers and without our volunteer physicians. I also have a lot of volunteer nurses who give back too. The other cool thing that we do here in our clinic is I have students. I have had students all of my life, and so we continue to have students here. No, just till they're 18, because I would say 98% of children are in the SHINE program. all of our patients have children. Most of them, their children are in the SHINE, which is the free insurance for Florida, for children. Only for my biggest population here is the working poor. You know, we have cooks, we have dishwashers, we have CNAs, believe it or not, that only work part-time because they only can because of their families or what.
Have you seen any changing trends and needs of healthcare or populations that you're serving?
Not really, because we have always been seeing the working poor, and during COVID, because you live in the woods, doesn't mean you qualify for Medicaid. But if you're so sick and mental health or physical health, then they move on. So that was a good thing.
Do you all utilize volunteers in any way?
That's all we have.
It is, well, I wasn't sure, I know you have a staff, right?
Yeah,
You have a paid staff.
It's a volunteer community clinic. That's what we are. So we base almost everything on volunteers. I don't even know, we have about, 7 people on staff.
Okay.
Yeah.
And then the rest of the force
Yes.
is volunteer. So you have a mix of both medical professionals and then just folks who want to volunteer their time to assist?
Absolutely. So if you'd like to volunteer, we'd love for you to. We have the front staff. They're not all medical. They just want to give back, and they come from various walks of life.
Able to handle all of the mental health needs of the patients that you have here, or so they're able to take people without insurance there. That's good.
We try the best that we can to work with them as much as we can.
How about non-English speaking people? Are you getting any increase in that? Yeah, I figured.
Yep, I had someone that was Polish in here the other day, and then we've had 2 Ukrainian, and they were all females. 2 Ukrainian females that the grandmother came over, and she came for a visit in December.
RNs.
So this is Susan, one of our valuable volunteer nurses, and I'm gonna put you on the spot.
Okay.
Can you please tell us why you volunteer here? She's gonna say me. Tell me.
That was definitely at the bottom of the list. However, just, because I retired in the end of 20 after health issues, and I wanted to continue.
Hello. Gina's our APRN. She's woman on deck today. Leadership Charlotte? Just say hey.
Hi. And then we've got Miss Kathy, Gina.
I'm Kathy.
This is Kathy from DeSoto Health. And what does DeSoto Health do in this house?
We kind of a two-piecer. I'm a case manager in the Ryan White program. So we serve a segment of our population. Our provider and our RN are also here. I'm sure
That's Sarah and Dean Green Blair. You want to stick your
They
heads
do
out here
all-
real quick and
they
say
do
hi?
all the medical stuff.
Okay,
They're all
good.
fine.
When people become involved at Virginia Meetings and they learn about the impact that it makes on the community, again, it's not just putting a Band-Aid on someone. You're impacting their family, you're impacting their children, their siblings, their parents, whoever it might be. When they realize what that impact is on the entire community, but you get somebody healthy, guess what? He's going to work now. He's able to support his family. So that affects us all. It moves them so much that they want to be able to give back even after they're
But I just wanted to take an opportunity to thank you so very much. The experience that you've had with Leadership Charlotte is one that you'll carry with throughout your entire life. It doesn't matter how young you are, how old you are, you remember it. I remember it like it was yesterday when I began. And that was 2014. So we are very blessed to have you in our house, our Virginia B. Andy's house. And whatever we can do to help support you on your journey and after you graduate, we would like to do that. We have many Leadership Charlotte alumni that come even volunteer or come back and just say, hey, I just want to see how you're doing, or refer patients, friends, family, if they're eligible. We have that happening too. So we just want to let you know that we are here for you and we want to support you.
Some of you may already know this, but when you serve on a board of directors for a nonprofit, when it's time for you to go, one of your jobs is to find your replacement. It's just the way it works. Would you say that's true?
Yes.
Yes.
It's hard to get out.
Right. So it came up in conversation, healthcare, and that being something I was passionate about with another attorney. And she says, "Oh, I have a job for you." So she got me connected to the Virginia B. Andes board, and I was accepted and admitted, and was instrumental in the process of buying that building and working through the process of finding the spot, looking for different options all over town, and getting the loan and the mortgage. And we were very fortunate to have our patron saint, Virginia, put a big chunk of that bill. And I got to meet her and spend time with her before she passed. She was a very, very, very cool lady. One of the first women high-ups at IBM.
Wow.
Yeah. And so then I spent my years on the board, and then left it in good hands and found my replacement for Leadership Charlotte. I probably would have never seen it, and I would have never had all the wonderful opportunities to participate in that organization and see how life-changing it could be. So you look back on your leadership experience, if there was a place that touched your heart, there's definitely some opportunities to get involved in, and leadership alumni are always good pickings for board members for different organizations, and it's a very worthwhile experience. That's it.
Thanks for the air, Ryan.
It's working, right?
Oh, it feels
Told him
good.
you'd have the AC going.
It works.
Where's John? I know. Oh, it's us. That's so funny.
It's John. There's John.
All right, John, everybody's here. Who's going to go? I think it should be Christine, since she was so into John.
Here that's working on him during training. We don't know, will he live or will he die? So that's how he was tasked with his name. Speaking of which, okay. I was going to say, is his chest rising? No, it is. So welcome everybody. My name is Alan Skavernak. I'm the Chief Operating Officer for Ambitrans Ambulance, and we're glad to have you join us today. We've got a little tour in store for you. This will kind of give you a little history about Ambitrans Ambulance, not sure who knows what about our organization, and then we'll do a quick tour around the establishment, answer any questions you may have, and then get you squared away for your next stop. Can everybody see the monitors okay? Trying not to block you. So the company itself, we're actually going to be celebrating our 40th year in business next year, so we've been around for quite some time. The company started out as a wheelchair service in the beginning, and later eventually transitioned into the ambulance industry. I'm not sure how many of you recognize the gentleman that's on the screen. For those of you who don't know, that is Michael and Maureen Grant, who are the owners of the company, and many of you may recognize the name. Michael is also our state representative and majority leader in the House of Representatives for the state of Florida. The building you're in now is about 6,500, so we grew exponentially when we moved in 2007, to the point that we outgrew this building the day that we moved in. So we identified the need to continue to grow and expand all the surrounding. We have 8 satellite locations in addition to this office, and the primary reason is just for deployment. We can't expect our employees who live in Manatee and Collier to drive here every day, especially today. It would cost a small fortune. We provide service to all the hospitals within the 5 counties. 8 freestanding emergency rooms, which are the new things that pop up. Fawcett has one that's getting ready to break ground on over by the Kia dealership in Port Charlotte. That'll be the first freestanding emergency department in Charlotte County. We also back up the 911 systems, in Manatee County, If they run out of resources, they will call one of their private providers. It's not that they're saying, go there, we'll be there. They're saying, take care of the call for us. And that differs by location. To the south of us, those counties don't want us to do that, and that's fine. In Sarasota and in Charlotte, we also back them up. Questions?
Are your drivers EMT, paramedic?
That
Or their
is
qualifications?
a great question. So depending upon the level of the vehicle that they're assigned to, we usually have both the basic life support, advanced life support, and then critical care. On an ALS or SCT rig, it's an EMT drives and a paramedic is the attendant. On a BLS vehicle, it could be somebody who's credentialed as a driver, which has lower credentialing, and an EMT. Due to the shortage, the state is now allowing us to put a driver on an ALS truck. Our crews come in here, they have the ability, when we talk about technology, we process through ADP, and they can either put their finger in here for biometrics, they can use their phone in order to clock in and out. They use these devices in order to document patient care records. So once upon a time with paper, trucks, personally, they're as aerodynamic as a shoebox on wheels. They may get 7 or 7.5 miles to the gallon. So, yeah, run some of those numbers through your head, look at what the sticker price is at the fuel stations, and say, ouch, because with fuel being what it is, that's what we've witnessed. Yeah.
Have you modified your costs based on the fuel costs? Like for services and...
We can't charge anymore or expect to get any more because of our reimbursement is relatively fixed because we get from third-party insurances and they have it modified accordingly. Our fuel costs, I will tell you, if you also revert back to, I want to say towards the beginning of COVID, where we were at our lowest point, about $1.70 something, you can figure it out. Yes, our fuel costs have gone up by almost 7. Is that a shower? It's not a shower. Showers are in our bathroom. It's it's in honor of Superman. It's no. So that actually is the lactation station. So in the event that we have any of our employees who require the need to do that, it's a privacy area which we're required to do. So that's what we came up with. It's actually, we could break it down and we can move it to one of our satellite locations if in the building. We also have our fleet maintenance. Now, being spread out over 5 counties the way that we are, it's not practical once again to bring the vehicles in to be serviced. So to accommodate that, we actually do mobile servicing. So this configuration that you see here, and everybody can take a look. It's equipped with tires, it's equipped with compressors, it's equipped with everything that we really need to take care of all of our preventative maintenance and probably 90 to 95% of any repairs that we may have directly out in the field here. And as you can see, we do have lifts that are here. Jeff and Dan are...
Hey there.
There are instances when we will run with that equipment on, I don't know, from Sarasota, from Lee, all the way to Tampa. I don't thrive on that, and usually at the end of the day, if they're staying local, you're only looking at maybe a 2 or 3 unit difference. It's more important to get there safely. And there are many agencies now that are doing away with authorizing their vehicles to go lights and sirens. It's tied to the type of
How's it going?
If you get to sit down tonight, you can have one of these.
And since that is kind of a challenging thing that we're going through, everyone is experiencing it. We just thought that it would be, we're doing an event actually on June 4th.
Yeah, the gala.
Yeah, the gala, the book gala.